Monday. Later today, the government is expected to call on the help of volunteers as part of an emergency plan to ease pressures on the National Health Service and on social care.
Another key focus will be on access to GPs, with Health Secretary Therese Coffey set to pledge that all patients in England will be seen within 2 weeks. And I'm pleased to say that the Health Secretary, Therese Coffey, is in Westminster and free to talk to us now. Good to speak to you this morning. I'm sure you'll be putting detail behind these headlines when you outline it in Parliament. But, of course, there will still be questions, and the ones that have been raised to us this morning by viewers and also by Dr. Hilary Jones, who I'm sure you'll be familiar with, is what are we going to do about the 130,000 vacancies across the NHS, about, you know, the huge shortage, the lowest since records began, of GPs generally. That is the real problem. And, for instance, changing just the way calls are taken to increase more lines into the surgery doesn't help, because it's the people to answer them that's needed.
Well, good morning, Kate, and good morning, Ed. And I'm delighted to be speaking to your viewers, particularly as today in Parliament I'll be setting out in more detail our plan for patients. And I'm very clear they are my top priority, and I'm going to be their champion. That's why I'm setting out expectations that when people phone up to try and get an appointment, of course, some people will need to be seen on the same day, and the clinicians will decide that. But I think it's a reasonable expectation that they should be able to see their GP within a fortnight, because we do ask people to come forward when they have certain symptoms, and that we want to investigate so that people, if necessary, can get the diagnosis and treatment that they need before illness develops much further. But I know how many patients actually enjoy the experience and have a great experience, but I'm also seeing very quickly within the data I'm seeing huge variations across the country. And that's why I want to make sure that we are publishing information so that patients are informed, but also helps the local NHS to work with those practices to try and see what we can do to help them with their approach in order to help patients get the care and in a good, timely fashion. But we're doing that a bit more broadly. Some of the freedoms that people wanted, we're going to be providing in terms of being able to unlock some funding that can only be used for certain recruitment today. We can open that up more broadly, but also diverting people away from needing to go to their GP, not only by continuing a more general prevention strategy, but allowing pharmacists to be able to prescribe certain medications today, which they haven't been able to in the past. So relieving some of some of the aspects that GPs do now and allowing them to open up their appointments to do what they do best, caring for their patients.
Why didn't you talk to the Society, the Royal College of GPs, before releasing this? They say you haven't talked to them about it.
I think there's been a lot of conversations with health practitioners right across the country over several years. We've listened to what they've been saying to us about some of the reasons why people are leaving medical practice, and that's what we'll be doing with some of our pension flexibilities. But I'm very conscious that we've got through COVID, but we still have the aftermath of COVID that's exacerbated issues like backlogs. That's why we've been investing in more diagnostic centres, but it's also an opportunity now to put very clearly my focus of being about patients, and in particular focusing on the ABCD, ambulances, backlogs, care, doctors and dentists. But I'm very conscious that most people access the NHS through their GP, and that's why I want to set expectations on their behalf and work with practices on how we can help make that happen.
Are you going to be able to provide more resources for social care, to pay their staff more and to hire more people to work in care homes so that you can relieve the pressure of beds being blocked in the National Health Service? Because a year on for the announcement on social care, there still hasn't been a workforce plan for social care, and there's lots of expectation. At the moment, people are still waiting for you to act.
Well, in terms of, I'll be setting out in more detail to Parliament, Ed, about some of our plans for social care, particularly focusing on this winter and next. But more broadly, the Prime Minister set out how she wants to see a shift in the overall health and social care funding, which we are directing into social care to relieve some of the opportunities to put patients in the best setting to get them the care We know that at the moment there are about 13,000 people on average in hospitals who don't need that clinical attention and would be better cared for outside of a hospital. And that will help us indeed to open up the opportunities for people to fill those beds by patients being handed over from an ambulance to that local hospital. So there's a variety of things of where we want to put, though, the patient at the heart of the decision-making and how we address some of the issues that are facing.
You'll need money for that, won't you? Forgive me for interrupting. You'll need money for that. Of course, the national insurance hike that's now been scrapped was there supposedly to fill that gap for social care and the backlog of the NHS. So there are funding questions which maybe you'll answer in Parliament today. But do you feel as though you've won the battle with the Treasury for NHS? We were talking this morning about how various areas have won battles on energy and on caps. Do you feel confident that you've won that battle and that you have the cash you need to deliver on the expectations you're raising?
Well, Kate, I think the NHS at the moment, or health, is already over about 44% of our spending, day-to-day spending as a government. And so there has been investment of funding into the NHS. I want to try and make sure we're unlocking where at the moment it can't be used, it can be used to give some more of those freedoms. But the Prime Minister set out on the doorsteps of Downing Street that there were three priorities. One was about the energy challenges that we faced in supporting the households and businesses with the cost of energy right now, but also the longer-term energy supply. She talked about how we want to have a growth in our economy, not managing decline. And again, the Chancellor will be setting out more detail tomorrow.
So does that mean you haven't had the conversation yet then? Sorry to interrupt again, but that wasn't really my question. I'm very clear on what the Prime Minister said about energy. Have you had the chance to have the conversation with the Treasury to know you got the funding to deliver on these expectations?
I was just going to conclude by saying about the NHS in terms of patients getting access to appointments. There already has been substantial funding. I'm building on aspects of the plans that are already in place, but seeing what more we can do to give greater flexibility to keep people in the NHS. This is still a national endeavour that's needed to bring clinical professionals back. So extending some of the things that we did during COVID to make sure we can address some of the immediate challenges as well. So a lot of this is about focus on patients' priorities, but also allowing freedoms in order to support our clinical staff to deliver that care and treatment in effectively and effectively.
That felt like a no, that you haven't had the conversation, that there is no more funding, you're going to rework what you've got. But maybe we'll hear more later. Sorry,
can I ask you, Therese, about your role as Deputy Prime Minister? Obviously, you're very close to Prime Minister, work with her very closely. You've been appointed Deputy Prime Minister. We read in the Times at the weekend that one of the Prime Minister's first acts was to move the press office in number 10 to the Cabinet Office, so that you are now occupying a large office previously used by the Director of Communications in number 10. So clearly this is a real priority. Are you chairing meetings in number 10 on a regular basis?
Well, we're still evolving as a government, and of course in the middle of this we've had the sad death of Her late Majesty the Queen. So the government is working at pace to deliver.
But you've got the new office in number 10.
And indeed, and I think what is a change, if you like, from the Blair era of displacing the whips used to be there and put the press in instead. Yep. What we're doing is working together so that the Prime Minister has at her hand the person who's in charge of the money, that's the Chancellor, but also the Chief Whip, and indeed me as Deputy Prime Minister.
And are you chairing meetings?
The people in Parliament.
Are you chairing meetings?
I will be chairing things like the Home Affairs Committee and different elements like that. But I'm here to support the Prime Minister deliver on what she set out to the Conservative Party membership and to the country during the summer. And I'm excited with this opportunity to make sure that across government we deliver on those priorities.
I know George Osborne found it hard to be Chancellor and also support the Prime Minister in number 10. I was asked by Gordon Brown to try and play that role, and I said, actually, I needed to focus on my education job. And you are in charge of probably the biggest department in Whitehall with a massive responsibility, the National Health Service. Is it really possible for you to do that work of leading the National Health Service part-time and also have an office in number 10 and be chairing meetings in number 10? Is it possible to really to do both jobs properly?
I'm conscious that in 2 weeks we've already pulled together our plan for patients, and we will continue to develop that. We'll continue to look at the data. It's only in the last week that with NHS Digital we've managed to get the average waiting time of appointments, average time for waiting for an appointment by practice. We will continue to evolve that. But yes, the Prime Minister has placed her confidence in me to deliver her priorities in both the health and social care system, but also support her in her delivery. I don't think it'll be a case of doing part-time. As you know, Ed, from your time as a successful politician, we don't have fixed working hours. We continue to do what we do right across government in order to make sure we function effectively as a government, and I'm looking forward to being part of that.
Thank you for giving us some of your working hours this morning, Therese. We'll look forward to seeing what you have to say in Parliament later. Thank you very much indeed.
Thank you, Therese.
Thank you.